Good evening and thank you for joining us. For the 9th consecutive day, the number of active COVID-19 cases in the Thunder Bay District has dropped. There are now 259 active cases, the lowest total in more than a month. Today's daily case count is down as well. The health unit is reporting 20 new infections today. 15 are from the Thunder Bay area. The remaining 5 come from elsewhere in the district. There are 8 household contact cases, to go with 4 close contact cases outside the home. 8 exposure sources are still unknown at this time. The total case count has now risen to 2,739. The 259 active cases is down from 283 on Thursday. Well, the situation is also improving at the Regional Health Sciences Centre. That's according to the regional's COVID-19 incident manager, who says by next week the hospital should be able to ramp up surgeries again. That good news comes with a caveat, however, that Thunder Bay is usually about 2 weeks behind Southern Ontario in terms of trends, and case numbers there are skyrocketing. Corey Nordstrom has more.
Things are better today, and we're really happy about that.
The regional hospital's COVID-19 incident manager says that based on current trends, they will soon be able to offer non-urgent surgeries. The latest numbers show the hospital is currently at 76% capacity. They have 30 COVID-positive patients in-house, with 6 of those in their intensive care unit. And Dr. Peter Voros says that allows them to regain some beds previously designated for COVID patients.
We're working right now on shrinking the COVID unit down to open up some beds for surgery, hopefully being able to increase some surgeries next week.
Hospital officials are still in the planning stages on which surgeries will be opened first. And the outbreak on the 1A surgical unit is slated to be deemed over by Saturday morning.
They've all been tested 3 times and come back negative, and it's been enough days that the unit will open again tomorrow, so it will really open up that space as those patients move or are discharged from hospital and allow a little bit more flow to happen.
The hospital is also seeing a large drop in those looking to book a COVID-19 test at their 2 assessment centers. Between the Medical Arts Building and the college testing site, the demand has fallen to about 60% of their testing capacity of 500.
People who need a test today can get a test today. And the turnaround time is continuing with most of these tests being done in town. So those turnarounds are in a couple of, a day or 2, people are getting their results.
The demand isn't so low that the 2 testing centers are able to decrease staff and shift some hospital workers to other roles. Corey Nordstrom, TBT News.
Some big changes are on the way for Thunder Bay and other parts of Ontario in the gray lockdown zone. Outdoor fitness can resume at a capacity of 10 people starting on Monday. Personal care services, including salons, can open on April 12th, also at a limited capacity. The Premier was asked today if the province is sending a mixed message, given that Ontario recorded more than 2,100 new cases today.
Call it mixed messaging. I'm very, very concerned. First of all, a message to the people of Ontario: do not let your guard down. Follow the protocols. Keep your distance. Wear a mask. Always wash your hands. It's absolutely critical. I'm always concerned, and we should never ever let our guard down. But in saying that, there's through the chief medical officer and the local medical officers, we're loosening it up just a little bit, and to be outside, to get fresh air.
Local hair salon owners are reacting to today's announcement that their businesses can finally reopen on April 12th at 25% capacity. Some are still worried, however, that limit on the number of customers will continue to pose challenges. Avery McRae has the details.
Brian Fresco, owner of Barber Shop in West Fort, has remained positive throughout the pandemic despite the struggles it has brought on the barbershop community. The 3 lockdowns over the past year have closed his shop for a total of 170 days and counting, but finally having some clarity is something he's been looking for.
Extremely excited. It's going to be excited to get back behind the chair and see our customers and our friends and people that locally come into our business. Uncertainty has really gotten to us, but it's nice knowing that we can go back to work and be where we want to be. We want to be behind our chairs.
Meanwhile, up the street, the owner of Michael's Hair Design and Day Spa, Michael Muya, has some concerns on the reopening plan. While the haircutting veteran is excited to bring back his customers, he says the 25% capacity limit and maximum of 5 customers will lead to booking issues at his shop, which has over 20 different stylists. With 3 floors at his institution, Muya was hoping for a capacity by square footage approach, but he's prepared to adjust.
I've done it before, and I know as stylists in this community, we have a great group of people, and I know that clients are already texting us, saying, when can we get in, when can we get in? So this is going to be great in the sense that we can do this, but challenging on the other hand on how to do it.
On Saturday, around 30 local salon owners and staff protested on Arthur Street, asking the government to either allow them to open or provide financial help. Meanwhile, the Thunder Bay Chamber of Commerce sent a letter to the Premier's office to change the current restrictions, saying it was unfair to allow some businesses to be open but not all. Chamber President Charla Robinson knows with the right measures in place, all businesses can operate safely.
We're pleased to see this as a step in the right direction, and we think this will really be helpful, especially for those businesses that have been closed for so long, to be able to open in a small capacity. We know they can do it safely, and we're so happy that the government is starting to hear these concerns and move forward to act on them.
Avery McRae, TBT News.
Vaccination clinics in the Northwestern Health Unit catchment area are far less busy than the ones here in Thunder Bay. According to that district's medical officer of health, there are still a number of spots open for vaccinations this weekend and throughout next week, particularly in the Kenora area. The region saw a number of new cases, with 2 more in the Dryden area, 7 more near Kenora, and 5 in the Sioux Lookout area. The Northwestern Health Unit currently has 50 active cases spread across multiple municipalities. Vaccinations for those 75 and over began in the district this week, but with a number of openings still available, Dr. Kit Young-hoon is encouraging those in that age bracket to book an appointment as soon as possible.
Staff have been doing is they have been going through lists of individuals who've registered for wanting the vaccine, and noted that if they don't have an appointment, they are trying to contact them and encourage them to make an appointment. So you may be getting a call from us identifying that that there are open spots and that people can book, and that we can assist you with booking.
The Northwestern Health Unit is also staying in the red level of the provincial framework. Young-hoon also announced that there are no longer any active cases of the variants in its catchment area. Fort William First Nation Chief Peter Collins has provided an update to his community on vaccination progress there, as well as on the loosening of some restrictions. Since the pandemic's onset, 28 cases have been resolved on the First Nation, with at least 2 still active. As cases begin to drop in the Thunder Bay area, Fort William members are no longer subject to a curfew within the community, and business hours have been extended on the reserve. As for vaccinations, last week 300 members received their second doses and 98 others got their first. The next mass vaccination date is scheduled for next Wednesday, with 204 people scheduled to attend. But Collins knows the pandemic isn't over yet.
Vaccinated in Fort William, we still can't let our guards down. We must be mindful of that. If you're going into the city, there's still a lot of spread. I mean, the numbers are coming down in the city too as we speak, but they're not to a point where we can get comfortable and let our guard down.
Chief Collins says he expects to have all members of his community aged 18 and older vaccinated by mid-April. The Ontario Vaccine Support Council is looking for volunteers from local businesses in our city to offer up their time and support as the province continues to roll out the vaccine. The online portal was launched to connect the province's public health units with privately owned businesses to assist with vaccine distribution. The Thunder Bay Chamber of Commerce, along with the council, will collect the information through the portal. It will then be shared with the health unit. Chamber President Charla Robinson explains some of the ways that businesses can offer their support.
Yeah, I mean, any way that a business might be able to help. So we know a lot of businesses, maybe they have extra delivery trucks available, or maybe they have large warehouses with extra space for storage of other supplies. Maybe they have computers or different things that could be used for the check-in points, iPads.
For businesses interested in lending a hand, they can visit vaccinesupportcouncil.com for detailed information. The council is asking that businesses fill in their information by next Friday. The Thunder Bay Regional Health Sciences Foundation announced the second big winner in its monthly 50-50 draw this afternoon. Edna Parsons of Thunder Bay got the life-changing phone call from Foundation CEO Glenn Craig.
You've just won $664,885.
What? Really?
You have. Just a look.
Oh, perfect.
It's a pretty nice sum of money on a Friday afternoon.
Oh my goodness. Wow. Thank you.
Parsons will take home that grand prize of nearly $665,000. An equal amount of the 50-50 proceeds will go toward hospital equipment. Foundation coordinator Lindsay Doran-Bonk says it was an exciting afternoon for everyone involved.
When we called the winner today, she was over the moon. She didn't believe it. She's like, can you check that ticket again? She had us check the ticket number a few times just to make doubly sure that it was her who won. So it was just so great. It's a wonderful feeling to know that somebody is going to win this huge jackpot. And she was also so excited that the hospital was going to be getting money for equipment as well.
The next 50-50 draw for April is already underway. Tickets are available online. That draw will be held on April 30th.
Really cool. I didn't win, obviously.
Nope, neither did I.
I was wondering if Ramsey won, but she showed up for work, so she didn't win either. Fiona, how's the weather looking?
Not as sunny as it is for our winter, that's for sure. We had mostly cloudy skies for much of the day, a few partly cloudy periods. Winds moving around quite a bit from the north, 8 kilometers per hour, kicking up as the afternoon progressed and rotating around from the southeast at about 17 kilometers per hour later this afternoon. Topped out with a high of 1, had a low of -5 and a wind chill of -10. If we take a look what's going on to the west, Fort Frances saw a low of -5 last night and warmed up quite nicely to a current high of +5. So looking pretty good despite a fair amount of cloud cover. As you head further north, temperatures take a bit of a dip to -1 in Kenora and Red Lake, where they've also got a bit of a freezing rain and snow mix. Warms up ever so slightly around Sioux Lookout. They've got a nice little pocket of warmer air, but -1 in Armstrong. One of the coolest locations in the region at this hour is Greenstone, but they're really not complaining because last night wind chills hit -25 in the overnight hours. So Greenstone's looking pretty good at -3 under mostly cloudy skies, -2 in Marathon. Sault Ste. Marie on the freezing mark, although wind chills currently feel closer to -7. Now, here in the city of Thunder Bay, we will see another cool night, a low of -11, a little below normal for this time of year, but not much of a wind chill because the winds are going to be very, very light from the northeast under partly cloudy skies. And as we head into the weekend, kind of a bit of a mixed bag. Now, the eastern half of the country, very warm and dry, northwestern Ontario all the way through to Atlantic Canada, seeing a combination of snow and as you head further south, transitioning down into rain-snow mix and then thunder showers. So we're going to see some snow, some precipitation this weekend, but once we get through that, we do have some warmer, drier conditions on the way starting Sunday and into next week, and I'll have more details on that later on in the news hour.
Thanks a lot, Fiona. Well, cases here locally have begun to go down. That is not the case across the country, where things have been trending upward, largely due to those more dangerous variants. We'll have details on the latest Canadian modeling numbers as your Friday News Hour continues.
If we ease measures too soon, before enough people are vaccinated, the epidemic will resurge even stronger.